Hey everyone. So welcome, it's Dr. Risoldi, and I'm a little bit solo. Ooh, you see my microphone. I'm a little bit solo tonight, and that's okay because we're gonna rock this thing out. I'm just getting a little bit adjusted. So I want to welcome everybody to our video here. So I'm doing it a little bit differently. I'm doing it on Nurses Against Violence Unite instead of the hashtag Nurses Against Violence Unite, so people can share this video. Again, I want to welcome everybody for taking the time out of your busy schedule and to be, spending time with me for the next, 10, 15 minutes. I don't have a guest on tonight. I did invite our busy friend down actually I'm in Florida. So in Florida, and she is doing an initiative. I don't know if you guys have seen this lady. She is on fire. She's down in the where I was over in the west side of Florida, over by the Clearwater area, and she is on fire. She's a part of Nurses Takes Florida. So she has rented this or has this big truck that has the staffing signs all over it. She is being out there. Like, I am so proud of her. And I want you to, if you're out in this, in the Tampa area, you can go to Nurses Take Florida, and she has all the instructions and stuff like that. Where she's going to be tomorrow. It's going to start at 9 a.m. And I really think that she's down in Florida. So if you're here, go. And, I really would like you guys to support her as well. Next week, we have ours, which is going to be over at, we're going to meet at Freedom Plaza, in which you could take the metro. You don't have to park down in DC. And then you could take it and go to, we're going to meet there at 10 o'clock in the morning at Freedom Plaza in Washington, DC. And then we're going to meet there for a little bit until about 11 o'clock. And then we are going to start walking down Pennsylvania Avenue. And then we're going to ascend upon the Capitol. We're going to be rocking out over there, and we're going to be loud and proud. And I just got this little toy in. I'm super excited about this, and it does all kinds of fun jazz. I'm super excited. I cannot wait. So some of my students would say I don't even need one of those, but that's okay. I think I do. Anyway, so I wanted to talk a little bit today about incivility and bullying in the workplace. So, I was taking some students to a clinical site, and, they realized, wow, it's really that bad. Like, not really any nurses were smiling. Everybody had the, RBF going on, and it was just a hot mess. I would try to go and make light of things, and it just was rough, and rightly so, because they were understaffed. And what do? They handled it really well. The facility, even administrators were on the cart. So I was quite pleased to see that. But still, that's very hard on them as well, coming off of, whatever desk job or whatever that they're doing, to come work the cart that they probably haven't worked in a few years. That's pretty much a good concept. Why do some CNOs why don't CNOs work the cart to see the trends in their healthcare setting so that they can put an end to any issues? I think that would be a great solution. So I wanted to talk a little bit about this today. So those that do know me know a little bit about how I've been affected by incivility. It just seems like it's just never ending. So when you think that you've gone to one place, it's and you think that you're out of the everyone's out to get you type of feeling, you have a little PTSD from some of the places that you were at. Like, I've had one nurse manager, lost her license for embezzlement, and she would always have people crying coming out of her office. I had nurse managers that would literally, one nurse manager told me that, hey, you're the bad nurse and this person is the good nurse. Wow, that's nice. Thank you. And it introduced me as such in front of the staff. I have had my share. We'll just put it that way. And I want to thank the KC show, Ingram show, for having me on last night. If you're watching this, I appreciate you. You're amazing. Thank you for helping me bring awareness to this huge problem that we're having. And I wanted to talk a little bit about, we were talking a little bit also about incivility, bullying, workplace violence, obviously, about the march coming up, and about OSHA. Now, in an article, and I'm going to post this on my page as well, risk factors for work-related violence in healthcare organizations. This article was from 2004. So they found that there was underreporting back then, and OSHA, and this is not the only article that I found, this is per statement of this article, there is no mandate from Occupational Safety and Health Administration, which is OSHA, or other authority regarding the work-related violence prevention measures, only recommendations. OSHA established guidelines to aid in the prevention of violence for healthcare workers. So that's what we have, ladies and gentlemen. We have recommendations, right? And then if you go to the incivility record, which I don't have that in front of me, I'm a little bit prepared, that they have this, where they're supposed to be reporting all these workplace violence issues so they can get like a handle on what's exactly going on. Well, we're nurses, right? So let's think about this. If it wasn't charted, did it happen or did it not happen? Let's think about that. So, okay, so I'm hearing a lot of you guys say, well, if you didn't chart it, it never happened. Well, same thing goes with reporting. If it didn't get charted, it didn't happen. So that's where we're at. So if it didn't, and then so what it does, it goes into their computer program. So this one had different segments in it. One was for falls, one was for medication errors, and then there's this one, I think it was at the bottom right, I'm not sure, but it said miscellaneous provision of care. So who's automatically taking the blame for this? To me, it sounds like it's worded like provision of something that, what we didn't do right? No pun intended. So to me, that sounds like we're automatically automatically admitting that we did something wrong because there's a provision of care, like we didn't do something right, which if a patient hits us, that's automatically what happens, is that we did something wrong. Not always, it's probably 98% chance that, either the patient was just straight up violent and psychotic, or, maybe the nurse just didn't catch something, or I don't know, there's different reasons. I can't predict why people get injured, but all I could do is report the things that I've seen that have happened. So, in the research that I have found. So another thing about this article is really quite interesting. They say that there may be also misclassification if subjects underreport their experience with violence because they felt that it was an expected part of the job. So this is in 2004, but I have literally stacks and stacks, literally about at least 6 inches thick of data just on workplace violence. And even though this is 2004, which is like, I'm not good at math. Let's see, about 15 years ago, it's still extremely valid. And not only that, it's gotten a lot worse. So increased patient contact increases the risk of both physical and non-physical violence. Employees who encounter increased patient contact, including but not limited to nurses, should be educated about the expected risk and follow-up plans implemented to support employees and prevent future occurrences. So what is that telling us, people? It is telling us, people, right? That sounded silly. It's telling us prevention, correct? So that is what my project is on. I'm waiting for it to get published, and then I will be happy to put it on this page, and we will have more discussions about why prevention is such a big key. So this is the article, and you'll see this on my page. On Nurses Against Violence underneath of the files. So if you're doing research, I encourage you to do as much research as you possibly can, because this just cannot be me that is working on this violence thing, right? It has to be like, if we even all unite, different organizations that are on Facebook, different, reach out, I'm willing to work with you. So, but we all need to bond together and do this. So here's another article that I'm going to talk about: incivility, bullying, and workplace violence. Look at that over here. Wait, oh, wrong side. ANA, American Nurses Association. So this was done in 2015. What I find kind of surprising is that there is like, they're talking about create an ethical environment and culture of civility and kindness, treating colleagues, coworkers, employees, students, and others with dignity and respect. That is absolutely needed. But what I'm having an issue with is that this is a, what is the words that they use for this? This is kind of a position statement. This is a position statement. So this is kind of, to me, it's just kind of like where the American Nurses Association, their values and what they feel like is going on, what should be going on in nursing. Well, these are not, these are awesome. I'm not going to lie. These are awesome. But here's the deal. Like if you are able to access this, I'm going to see if I can find it and link it up on my page. It has really good information about bullying and people bullying you in the workplace. So when we talk about, they talk about bullying as repeated, unwanted, harmful actions intended to humiliate, offend, and cause distress in the recipient. Bullying actions include those that harm, undermine, and degrade. Actions may include, but are not limited to, hostile remarks, verbal attacks, threats, taunts, intimidation, and withholding of support. We have a lot of that in nursing. Why is this being overlooked so much? Is it because of, I know that when I pay for my American Nurses Association, is about $291 a year. Maybe people aren't joining, and maybe it's the fact that cost is, it's extremely awesome, like the membership. But here's the thing: not a lot of people have $300 or see the value in that. So does any of this information get out to the public? Not really. So maybe that if anyone's in the American Nurses Association, they can make that suggestion that, maybe we should lower the cost so this could be affordable to more people. So we can get some more things going with our American Nurses Association is the highest and the most looked at as far as regulations and supporting nurses, but I haven't really honestly felt that very supported myself, and I'm a member. So I'm just throwing that out there. I'm probably going to get flack. I don't care at this point. But they have really good documentation, especially with the Nurse Views panel. I wonder who helped out with that. So yeah, I'm not making any comments. So anyway, so this is a really good document. It's a position statement. It's the incivility, bullying, and workplace violence, but it's written by Professional Issues Panel on Incivility, Bullying, and Workplace Violence. Now you're going to find a lot of places that have zero tolerance policies, but do they actually enforce them? Absolutely not. So, it's a good start, at least. Maybe we need to revise those and start making sure that people are following what they're talking about. Let's see. So this next article is safe nurse staffing. So, to go along with my friend over there that's doing the rally over there in Tampa, I'm so proud of her. Seriously, it is like she is just taking the bull by the horn. She's amazing. A win-win collaboration model for influencing health policy. So this is something too. If somebody's doing some research, I applaud you for taking the effort to go and do some more research and build up your case like I have. So this one is talking about how we can work together and try to help the problems with, staffing, collaboration model, influencing healthcare policy. So influencing things to happen amongst healthcare and nursing. So this is provide recommendations for appropriate staffing. 3 guiding principles from this document provide basis for any effort aimed at alleviating the nurse staffing crisis. Nurse staffing patterns and the level of provided should not depend on the type of payer. Evaluation of any staffing system should include quality of work-life outcomes as well as patient outcomes. That means taking care of the nurse and their quality of life as well as the patients, you know. So, and it should go both ways. Like the employers, if they want, you know, there's this thing that we would joke about, like, you know, when I was a younger nurse, we would talk about happy nurse, happy patient. So is that valid? I would like to hear your comment on that. That I think it's absolutely true. Staffing should be based on the achieving quality of patient care indices, I can't talk either tonight, meeting organizational outcomes and ensuring that the quality of the nurse's work life is appropriate. Now, how often are places understaffed? Okay, so I'm probably imagining you probably are yelling at me right now. They're always understaffed. You know, and on top of that, like, you know, what is happening? Why are people calling off of work? Why are people not coming to work? I mean, if it's happening on an ongoing basis, could that be culture? Could that be the culture that maybe the organization is creating and they're not realizing it? Because, you know, things trickle down from the top to the bottom, not from the bottom to the top. So, and don't get me wrong, okay? So I'm not all against organizations, okay? Because they're trying to do their best and they just don't know which way to navigate. From our standpoint, we're always going to be like organization, 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 which it does play a huge part, doesn't it? So this article is also talking about creating a collaborative environment. So that means, what is collaborative environment? That means people working together, correct? Yes. So we all want to work together and make sure that we are able to have that culture of caring amongst each other, because we are absorbing each other's behavior. And then when we go out and we take care of patients that are potentially violent, they take us the wrong way. Now, I've been told by some of my, and I don't know if you guys have noticed, I hope not. I've been told that I have a severe case of resting bitch face, and I hope I don't, because people that actually talk to me know that I actually care about them, and I would hate for that to happen. But, you know, again, I'm not perfect whatsoever, but I do try to make up for my facial expressions. I guess I'm pretty animated. Let's see, what else can I talk about tonight? I'm sure I'm going to forget something. But regardless, I mean, we're going to still continue to hold these every week. And because I want to make sure, and I'm going to have special guests. So if you are wanting to come on here, I'll probably ask you a few questions to see, you know, where you're at and what you're doing. I'm pretty excited. I really would like to have, like, if you're doing something different in healthcare, if you're trying something with nursing, if you're an EMT, if you're a therapist, if you're a doctor, I would love to have you on here. I wanted to mention again, so we are having our March next Friday. Like, it's like just zoomed by. I'm working literally up until I leave for DC. Like literally every day, and then I'll be leaving, and then I'll be doing sightseeing and stuff a little bit on Wednesday maybe, and then Thursday, and then holy smokes, Friday it's going to be wide open. So if you are a nurse that's coming, please, or if you have been a victim of workplace violence, that means lateral violence, and or patient on nurse violence, or patient on healthcare worker violence, please wear white. We would really love you to come and help us out with making awareness, because if you want all this legislation to happen, guess what's got to happen first? You got to build awareness. And if there's awareness, there's going to be outrage. If there's outrage by the public, then things are going to be even more. They'll actually pick up with, you know, they'll be like the fire burning underneath of the legislation's butt. So if this makes sense, well, I hope it makes sense, because if you know by watching the news that anything that ever happens is usually by public outrage. So if we can talk to as many people as we can to get them to come out to the march, our friends, our family, everybody's invited to come out, I would be most gracious. And because it's not just for me, this is for like every healthcare worker in the United States. So we've been talking about this for a while, and I think there's going to be some people coming out from different states that are going to be supporting us. It is going to be so much fun. We are going to have a blast. It's going to be a little nerve-wracking because it's my first one, but we are going to make a difference. So again, we're meeting at 10 a.m. Eastern Standard Time. We're also going to be having, some videos. That everything's not going to be posted on Nurses Against Violence. I'm not doing this just to be on there to, raise awareness, because I don't know if I'm even going to remember to post a video. So please come out if you're in the area. Come out, support us, and we're going to have a blast. And then it starts at 10 a.m. We're going to start walking at 11. And, come by, say hi to me. I would love to meet you. And let's make this thing happen. So it's August 2nd at 10 a.m. and it's going to end about 2 o'clock, depending on, what we have going on. You could bring your posters. You can make a statement. Just please do not do any advertising. I'm going to be posting the regulations and where we're walking and stuff like that. So that way that you have an idea when we're going there, and the rules and regulations from the police and the 3 different agencies that we're going through with the permits. So again, thank you so much for your time tonight. I know that you're very busy with your work life, your work life and your home life. And I appreciate you coming to spend this few minutes with me. So next week we should have a guest. If not, then I'm pretty sure I can grab a guest next week, but we'll just see. So I'll be, running around with the airport stuff. So, all right. Well, thank you very much. And you have a good night. This is Dr. Risoldi.